Illinois becoming the first state to require annual mental health screenings in public schools. It will be in grades 3 all the way through 12th grade. Students will be tested for early signs of anxiety, depression, and trauma. Parents will have the choice to opt their children out. Here's Governor J.B. Pritzker when he signed it into law.
We've got to overcome the stigma. We've got to make sure that we're screening kids. And then as you're pointing out, we need to make sure that we have available to kids the kind of treatment if they need it.
So let's bring in our family physician and psychologist, Dr. Leonard Sax. Dr. Sax, thanks for being with us.
Thanks for inviting me.
You're welcome. Well, as a doctor, can we trust our schools? Wouldn't you send your child to a doctor, not let the school determine this?
My short answer is no. I don't think we can. I'm concerned. 20 years ago, I've been a medical doctor for 39 years. And in my book, The Collapse of Parenting, I write about what we call the medicalization of misbehavior. There's kind of two ways of looking at kids' misbehavior. There's the moral way and there's the medical model. The moral way is to say, your kid is rude. He's misbehaving. He's talking back. And the medical model is your kid may meet criteria for oppositional defiant disorder. The United States is already an outlier. And a kid in the United States is 14 times more likely to be on medication for attention deficit disorder compared to a kid in the United Kingdom. And this new mandate, this new law, is likely going to put a lot more kids on medication. And I'm concerned, I read the press release from Governor Pritzker. I've looked at this law. There's no medical oversight. This is being run by the Illinois State Board of Education. And it's not the kids who are doing the screening. It's not the kids who are referring themselves. It's the teachers who are doing the screening and the teachers who are referring themselves. So if Jimmy is acting up in 4th grade, this is going to make it very easy for this teacher to make sure that Jimmy gets referred, make sure that Jimmy gets medicated. And I, as a family doctor, I've been involved in these cases where the parents get this very alarming letter saying your kid needs to be evaluated, and if he's not evaluated, he may not be able to stay at this school. And the parents are freaking out, and boom, Jimmy's on medication.
Wow. So Abigail Schreier, she's an author. She wrote Bad Therapy. She talked about when her son went to sleepaway camp and then he had a stomach ache. So she just took him to urgent care. And she said that they made her leave the room. The nurse asked her to leave the room so she could administer a mental health screening tool. And she said verbatim, these are the 5 questions they asked her son. In the past few weeks, have you wished you were dead? Have you felt you or your family would be better off if you were dead? Have you been having thoughts about killing yourself? Have you ever tried to kill yourself? If yes, how and when? Are you thinking of killing yourself right now? If yes, please describe. Does this convince the kids, put thoughts in their head that they might not have ever thought about? And she says it encourages many to think that they're sick, and many of them are false positives. What do you say?
Well, it's any test has a false positive rating, but again, that's not what Illinois is doing. They're not asking the kids to screen themselves. So the Abigail Schreier example is not quite what Illinois is doing. Illinois is giving the teachers an opportunity to refer the kids that the teachers are concerned about. And that's what I think is really dangerous about this Illinois law, is that it's making it very easy for teachers to flag the kids who are troublemakers. And instead of working in the moral model, your kid is rude, we need to teach your kid to be a gentleman, to be self-controlled, it's shifting the responsibility away from the parents and the student into the medical model. Your kid may meet criteria for oppositional defiant disorder. Let's get him on medication. That's the problem I have with what Illinois is doing.
Yeah, I mean, teenage girls are hormonal. Teenage boys, they don't want to sit still.
And it's not just teenagers. This is starting in grade 3. That's right. Another big problem I have. We're talking about 8-year-olds, that they are encouraging teachers to refer for evaluation and treatment. And it's not the kids who are being screened. This is not the Abigail Schreier story. Right. This is the collapse of parenting story that I'm talking about here, with teachers being encouraged to flag kids for treatment and referral. That's why I have a problem with what Illinois is doing here.
Dr. Sax, thank you so much.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.